everything we're going to talk about really accessible to you guys. So,
Everybody, let's finish, go ahead and finish your presentation. Okay. We got a handout card with a QR code on it and we're technological.
Everyone knows.
Yeah.
Okay, can
we
you
also have a QR code session later today.
We will be. Welcome back, everybody. We have here the Vermont nurse and nurse practitioners in today because it's their legislative day as well. And we're looking forward to hearing from you and great work that you do for Vermonters.
Thank you. I'm Kate McFawn Williams. I'm ANA Vermont Secretary. I'm also the delegate to ANA membership. I'll be going down to DC. I'm an RN case manager in a trauma level 1 medical center. I work over at Dartmouth Hitchcock. I've also been a school nurse at Waits River Valley School, and I've worked in community care over at Heater Road Primary Care as well. And I love healthcare. I love designing policy, crazy about nurses, and mostly what motivates me is my family. And over 32 of my family members get care here in the Connecticut River Valley and in central Vermont. So I'm interested in shaping policy to help bring the nurse's best to the patient side. So we've got a few things we'd like to discuss with you today. With H585 right out of the gate, an act related to health insurance reform. And my colleagues will share a little bit about that. I know we've got 15 minutes, right? So I'm going to try to be quick. The biggest piece on this legislation that I'm concerned about, our coalition is concerned about, is we're urging legislators to strike Section 11 and retain existing law enacted under H31 Act 3. So we all know how difficult it is to get prior authorization, and it will take away from patient care and increase burden. So this has big effects on how we're going to work with throughput and taking care of our patients. So we would like to have that strike that section 11. Any other big comments on this? No. Okay.
So that was the prior authorization section, right?
Yes, that.
Okay, thank you.
Yeah.
Independence.
Justice.
That's on H585.
H585, act relating to health insurance reform. And the biggest piece that I would like to have you take away today is that nurses need to be at the table. They need to be help designing hospital governance as well as healthcare governance. Please ask us, those that are patient facing, an RN or APN, to be part of the committee. Currently what's working, and I'll just step out of the coalition for a minute. Currently what we're doing isn't working. And I think it's because you don't have a patient-facing clinical nurse at the table, an RN or APN, who has the skills to work at the board level and on committees. And I think that we can help solve some of these problems. And I know it always takes money, but we can be clever with that. And we know how to identify problems, make an assessment, a diagnosis within our scope, and we know how to make a plan and evaluate it. And part of our expertise with this is Act 9. Thank you so much, H259. Last year we helped design that law and got how to prevent workplace violence. And so now we're building the toolkit and we're going through the state of Vermont to get all the hospitals standardized with that. So we put in the work and we follow up and we do an evaluation. So that's what we're working for. And very quickly, we know we had Act 24, which said you can't harm a healthcare worker. We know we have that law, but this law that we helped do last year is going to help prevent that. And so we can make things happen. So we need to be at the table. H573, an act relating to the first certification of an emergency room examination. Liz will be our expert on that.
So Liz Cuyo, I work for the Emergency Nurse Association. I'm one of the directors as well as the Government Affairs Committee Chair. And this is really important to align the verbiage of what is actually happening in emergency departments to ensure that patients are getting timely access to care in an emergency crisis situation. So currently right now across the state, a lot of emergency departments are staffed only by PAs, especially on off hours. So any patient that comes in during off hours where there is not an APRN or a doctor that can complete this, their care and access to the treatment that they need is significantly delayed. And that is directly related to escalation and decompensation on their part. And as a nurse, really realigning the verbiage to ensure that there is protection for those patients getting equal access rather than delaying their access based on how it's currently being done throughout the state. UVM has PAs that see them to complete these under an agreement. But again, to just ensure that everyone coming into emergency departments across the state can ensure that they have that timely access to care. I think it's really important to understand that this does not decrease the level of care that these individuals get. The qualification process to ensure that you are completing an emergency evaluation is equal, no matter who is completing it, whether it's a doctor, an NP, or a PA. So they have the appropriate education and the appropriate qualifications to do this. It is just aligning to ensure that those individuals get access appropriately and timely so we can get them to where they need to be for their care.
And I think we'll move on to, I know we have 15, so I wanted to make
Yeah.
sure that.
So, excuse me, currently there's a bill sitting in the Senate Health, S-163 that Representative Goldman was so kind as to have a companion H-569 for. It started over in the Senate. It's going to be moving its way out of there very shortly. But what I wanted to bring to you folks ahead of time for this is not a change in scope of practice. This is a language cleanup. All we are trying to do is modernize the language so that it reflects the scope of our practice and reflects what's actually happening in most of the rural hospitals in the state at this time. It's no change in scope or clinical practice. And I said that 3 times intentionally because as an educator, I learned you have to say something before it sticks.
Oh, 6.
Oh,
She got 3 more.
Yeah,
boy.
All right.
But this is just simply about clarification and language cleanup, and it's been being discussed with both BOZ and VMS, and I believe it's going to come over to you guys in a very nice tied up package.
So, and then we'll jump into a real complicated one, but HR 1, Rural Health Transformation. So our statement is that the Vermont Nursing and Nurse Practitioner Coalition is a resource to be included in work groups, committees, and for operational guidance to implement the award of $195 million annually for 5 years. And we know after 5 years, this could be real problematic. It's difficult now as well. We have the necessary expertise in care delivery and nursing and nurse practitioner scope of practice that is necessary to ensure our communities have access to high quality, affordable care. So again, we're asking to be appointed to committees and participate in how we're going to shape this healthcare. We have some ideas, we have some solutions, and we're willing to do the hard work. And I think we've proven how committed we are and successful we are.
And I want to say, tagged on to that, Act 68 last year did appoint some nurses and nurse practitioners to some committees for rural health transformation. Bridget here sits on the primary care committee and is bringing forward ideas from boots on the ground providers to that committee. I'm sitting on one of the committees as well. And so what we're saying is please continue to do that because we are now being able to get our voice heard where it was never being heard before. And what we're bringing forward is what the real barriers are to being able to provide cost-effective, safe care for our patients.
And the last couple acts or bills rather that we're concerned about, S208 and S209, an act relating to standards for law enforcement identification and an act relating to prohibiting civil arrest in sensitive locations. So currently, law enforcement can't go into a patient's room or into locked areas. We'd like to see that extended to the lobby and the hallway because we can't have this kind of distraction taking us away from patient care. That needs to happen outside of a hospital, clinic, and a home health agency, outside of those walls. We ought to be able to see the person who's coming in. We all believe in masks, 95, we don't have a problem with that, and identification as well. And so that's a bill that's with the Senate. We were going to meet with them today, but they were tied up with their judicial nominations. And so that's what we to present today. The QR code will give you more information about our positions and which bills we are following. Yes.
Well, I was just wondering, are there any hospital boards on which nurses are present and represented?
So
Probably should ask.
Yeah.
188 is another bill that we've really tried to emphasize the importance of ensuring that if you're appointing people, you're finding the middle ground, who are the right people to be appointed onto that board. We've had a discussion about how each board is managed differently or selected differently across the state and whether or not that's currently working. We would really like to participate in how that is better outlined to ensure that maybe somebody who, practiced years ago, is currently speaking as a nurse, but isn't currently speaking out of an like our national organizations that help direct care. Nurses are known for balancing the whole picture. We balance the financial responsibility with the quality of care and the resources. There is no prioritization of how we're going to make this financially profitable, but instead, what do we have in front of us with what resources? And I think when we talk about being at the table, making sure that we are putting those people and appointing those people that are best qualified to have transparent conversations about what decisions are being made to support our healthcare facilities and our communities. And again, when we say we want to help you, we've been in this committee, we enjoy working with you, we enjoy these conversations even when they're challenging. But at the end of the day, if we're implementing decisions on how healthcare should be done and we haven't integrated someone or asked someone, can this be possible? A lot of the times we're finding that silence of who did we talk to is unfortunately leading to gaps in how it's implemented and the success of that. So we do really want to ensure that when we talk about what does this look like, right? It's not, yes, we support this, no, we don't. How do we kind of carve this out to really ensure that it is meaningful and it gets at what it's going to? Because I think that there are uncomfortable conversations to be had around it. But again, we're all here to kind of figure out how we're going to continue healthcare reform in the right direction.
Yeah, and the nurse is best at the patient's side. We are there for people's and families' best days and worst days. We know how to have incredibly difficult conversations. We're good at that. So we're good at that on the committees. So that's our appeal.
Awesome.
I come from the southern part of the state, Wyndham County, and Brattleboro, and I get this from the newspaper, has had a lot of challenges. And one of the reasons nurses were not sort of invited to be on the board or involved in this was because of conflict with the elective bargaining agreement. And I don't know if you guys have come across that. And I was just looking for some help with understanding that issue.
Yeah, there are some restrictions with that. I'm not an expert at it, but we will find somebody to answer that question for you, particularly since we've had some healthcare facilities in the state that have union representation. As an association, we're not a collective bargaining agent. So that would be a pool to think of. But we'll get back to you on that. But I'm sure there are some
I
restrictions.
wanted to push back on it, I guess.
I think it's asking for more clarification and more conversation, right? I think that's really just a blanket statement without understanding how unions work. I, as a leader, work really well with my union, as well as work really hard to ensure that our relationship from administration to the direct care nurses is cohesive and collaborative. So I think that, again, as we continue to have the conversations and narrow down what we're actually getting to at that, it doesn't necessarily need to be a union nurse that's direct care from a union, right? So there are a bunch of people, 130 people here today out of the American Nurses Association that would really be great representation from where they come from that have the qualification background. And again, I think that is a part of like the further conversation question.
Thank you.
Casey. Thank you so much for coming here. When I see the nurses taking over this building, I feel like we're in the presence of something great. And I just want you all to know how much it makes a difference to see.
And I'll also say, I'm not my father's daughter.
Yeah.
I also say that, you're in a really safe space. I mean, we are, you've got all these nurses here around. We're all in a safe space.
And I wanted to point out that there are still bills being introduced. So there's a couple that I want to put on your radar. One is H-850. And I'm not going to go into describing them right now. And the other is H-836. One has to do with arrests in sensitive places or something, and the other one, H-836, is regarding requiring hospital board meetings to follow public open meeting laws.
Yeah, we've
That's my bill.
reviewed that a little bit. And again, It's a lot, right? So a lot of us generally are in direct care with full-time jobs and we're trying to like keep a pulse in here in our spare time. And those conversations where somebody reaches out and says, hey, have you seen this? Could you review it? What do you think of this? And to say like, yeah, you're going in the right direction, or like, this seems fine without, you don't have the direct care need. But it is so helpful if you guys, again, you say like, hey,
Flagging
did
them
we,
for 'em.
yes, did we reach out? Did we have this conversation? We have a question. We're just as accessible as you guys have been made to be our voice. We want to be here to be, our organization's voice.
Yeah,
We also have Gail Zatt from Zatt and Renfrew employed too. So certainly she's an avenue that's in the State House all the time and can reach out to us all the time.
so.
I think Liz touched on H 573. Were you okay with it as written or written, or were you looking for changes? It's Daisy's bill, but.
I know.
But
Daisy and I have had, and again, I mean, full transparency, she reached out and said, hey, what is a barrier? And I said, access and what we're actually doing. And I am curious, I've been curious, like, to see where conversations would go with this. It does have a little more than just a PA, and how those conversations could, again, I don't want to say I approve it in completion before we have conversations with everyone that is touched by that. But I do want to participate in the conversation to ensure that you guys put out a meaningful bill that allows appropriate access to the situations that we have.
we'd like your input.
What's my input?
I'm not. What's that? Well, no, that's we got to take it off wall.
Yeah, I think, again, there is nothing that I felt that when we gave like the leave behinds that I really strongly felt about. Again, I think that this bill is going in the great direction around providing access to that care. I do want to acknowledge that we should always be careful how expansive that gets, with who else has access to that. And that is just a really important part of the conversation when it does come off the wall.
Yeah.
That I think it's
And-
really interesting.
I think it's important. We support this, but let's ask the PAs too.
So yeah.
They're in support.
They're very much in support.
Yeah.
But I would also just remind people, and I am sorry, I don't have the exact year, but it's within the last 3 years that APRNs was just added to this. So APRNs have only been able to do this within the last several years. And that was because we also asked for a rules change. And at that time, the PAs were a little busy with other things. But we should have included them at that time. And so we certainly support them. And it is definitely within their scope of practice.
Last question, Brian?
It's a two-part question. The first is can you remind us of the National Association of Professional Association with which your profession is affiliated?
Nurse practitioners or the American Association of Nurse Practitioners?
The AANP?
Correct.
Does the AANP have any clinical guidelines or policy recommendations regarding the emergence of artificial intelligence in healthcare?
There are
So can you briefly tell us, because we only have a minute?
Yeah, actually, what I'm going to do is tell you there are some statements. I don't have them in front of me and I'm happy to get them to you.
So we could always tap on you as a witness if we look at the issue.
Absolutely.
Yes.
And so
Okay.
Kate is here specifically as the American Nurse Association, which is national.
Yeah.
This is our Vermont chapter, and I represent the Emergency Nurse Association, which is also national.
Okay.
So we all have had, we come together because these priorities and these conversations come up for all of us. And it's so much more beneficial for us to collaborate and come together on our position statement and how we want to guide our state in these situations, but we're directly pulling them from national guidelines.
Right.
Yeah, that's what I figured. Thank you.
Yeah.
I know that AFT nurses came to the Progressive Caucus to talk about their concerns about AI replacing nurses in a way that endangers patients, but that's only one of the many uses. And so it would be interesting at some point if we look at the issue to hear your national perspective as well as the local. So thank you for offering.
Our
Yeah,
ANA
happy.
president, Jennifer Mensick Kennedy, ANA president, had just came out with a statement, haven't read it yet, but we are.
Just did.
Just did,
Yeah.
within the last,
Yeah.
we were preparing for this.
Yeah.
But it's-
Yeah, yeah.
it's a big conversation, right? So what does an AI triage kiosk look like to replace a triage nurse in an emergency department? That is very different when you can come in and check a box for chest pain, versus what my response is looking at you immediately to know sick, not sick, chest pain for the last 7 years in regards to like an ingrown hair. Again, that is something that it's true. You can't, replace us. And I think there's a place for AI and I think there's not a place for AI.
We'll look forward to the discussion.
Thank you.
Thank you so much.
Thank you.
Thank you.
Thank you so much.
Take care. Thank you much for your support.
Thank you
and-
very much. I think I'm. Oh, it is. Thank you so much.
Kathy,
Yeah.
Kathy, is this yours?
There's my phone. Thank you.
Here for-
Yep, lose that.
I cannot get stuck down there.
Well, you know what, I was here, we had a lot of people.
Yeah.
We did like this. Yeah. They were passed.
I'm putting it in a pile of cards here so I don't lose them. We'll reach out.
All right, you can, everybody.
Take care.
Okay. We're hearing from the Governor's Institute and we have the director with us. You want to come up, Elizabeth? And do you all want to come up together? Perfect. Awesome. And we have one other person who will come up after. Let's, Mr. Fisher. Would you mind bringing that chair up?
I can do that.
Oh,
So Jeremiah, you want to join us?
This one?
Wait, give me this scooch over.
Here you go.
Oh, yeah, that makes sense.
Awesome.
And Jeremiah, when you stand here, it's kind of makes you go that way. Yeah.
you're good, you put, oh.
Yeah, then you guys can be eating over a table at a. Okay, great. Thank you. Hi, welcome. Happy to have you in today. Tell us about what you are working on and how your experience has been.
Thank you for having us. Do we still have 20 minutes or are we crunched?
You have until 2:45.
Okay, great, wonderful. My name is Elizabeth Frascoya. I'm the Executive Director of Governors Institutes of Vermont, and we're really pleased to be in front of your committee. I don't know that we've ever been in this committee before, but we're really excited to talk to you about what we're working on. And so I am going to give you a quick overview of what GIV is and how I think it fits into like the work that you are thinking about. And I'll turn it over to our students to give you a fresh perspective on the Health and Medicine Institute specifically. And then I have another older alum and board member to offer his perspective. So thank you again for having us. So the Governor's Institutes is the mission is to inspire our Vermont young people to do meaningful things with their lives. We do that through these intensive summer programs that take place on college campuses across the state. They last from 1 to 2 weeks long. Students come, it's their first sort of collegiate experience in many cases. They live with a roommate, they eat in the dining hall, they attend classes and workshops, and often are getting a lot of choice in how to spend their time. So kind of learning to navigate an independent college post-secondary experience. We offer these in topics, many topics. We have 8 this year, from the arts to technology, AI. We just did a day on AI and cybersecurity and thinking about those issues. But what I wanted to focus on in this committee was our Health and Medicine Institute, which has grown in popularity and demand over the last 8 years since we've been offering it. We began it, it's always been in partnership with the AHEC network. I'm sure you are in contact with those folks. They're wonderful partners for us. And they help us deliver that. They bring expertise. They help us give a really broad spectrum of pathway expertise for young people, whether they want to be nurses, whether they want to be respiratory therapists, or they have never heard of respiratory therapy. We're trying to open a lot of doors and say, there's a lot of ways that you could participate in the healthcare sphere as a professional. So we started with 35 students. We doubled to 70 students. We doubled again to 140 in 2 different sessions, which we've been doing for a few years now. This year, I'm very excited to say, and a little bit of the materials I sent you are centered around our move that's happening to UVM. So we have been at Vermont State University at 2 different campuses. We're going to be able to bring all 140 students together this year in one place for a really exciting, it's 4 days virtual and then 7 days actually on the UVM campus. We're going to be in partnership with the Health Center, in partnership with the College of Medicine and the College of Nursing and Health Sciences to try to really bring together a lot of components of healthcare. And we hope to build that relationship over time. We are a nonprofit organization. We were founded by Governor Snelling back in the early 80s in concert with the Agency of Education and at that time the Arts Council. We started with the Arts Institute, but have grown to many other topics. A couple of important things to know. I know that you had a little bit of information background just to refer later, but one of the crucial things that we do is make sure that students can access this opportunity no matter what their financial situation may be. So about 90% of our students receive some amount of financial aid to attend the institute. There is a tuition fee, but it's on a sliding scale based on your family's income. So 90% of people get aid. 55% of students in the last 2 years were low income. So that's just like a really important thing I wanted to say. And I'll turn it over to you all in just a second because we don't have too much time together, but that need has increased significantly. And so I'm not here to ask you all with a money ask, but we do have a money ask in front of the education committees that will go to appropriations. That we are doing a lot with a little. We leverage the money that we get from the state appropriation. It's about 20% of our budget. And it's just under $400,000. We'd like to see that go a little bit north of $400,000. We have a specific ask in front of them. So if you see that coming through and you can be supportive of that, I appreciate it. Let me see if there's anything I want to tell you before that. Oh, the other thing is that, really in partnership with the Vermont schools, but we're also not only looking at educational pathways, but career pathways, so that students are working with working professionals. People volunteer their time to show up. Last year, we had like a whole team from UVM's pathology research. They are normally like in a basement alone, I guess. But they were so excited to come and talk. They spent 2 full days with us, one at each session, just sharing like really passionate excitement for what they do and how important that research work is.
Or they were really excited to get out of the basement.
Yeah, maybe both. So I'd love to turn it over. Is that my phone ringing? I'm so sorry. It's telling me to pick up my children.
Leslie, yes, but what age?
This is for high school students specifically. So we're looking at early pipeline, 9th, 10th, and 11th.
Yes, so go ahead, Leslie. So I'm wondering if the AHEC funding got reduced, how would that affect this?
Significantly. And I know that they were not included in the governor's budget this year, which is quite concerning to me. My understanding of that is that their Department of Health funding specifically funds early pipeline. So they provide in-kind support, expertise, and it would be very devastating to us. I don't know what we would do without them.
For this program or all of it?
This program specifically. And I should just say one other thing, which is that beyond those 140 students, we're still turning away at least 100 more. Like we'd love to grow this program, continue to grow it. We can only do that with continued sustainable support from AHEC and our partners.
All right,
Okay.
Yeah, my name is Henry Gogo. I graduated Rice last year. I'm currently taking a gap year. I'm gonna attend UVM this fall, and I am a 2024 Medicine alum. I'll touch base on my experience with GIV and how it helped me understand more about what I want to do in the future. I think GIV is really, really helpful just to expand young people's understanding on what they want to do within a certain subject. I knew that I wanted to get into the health and medicine related subjects, but I didn't know what exactly I wanted to do. And after going to GIV, I was exposed to many different career paths and steps to how to get there. But not only that, just all the hands-on learning that we did with not only our peers, but with the professionals that are really passionate about doing their jobs. And and it just really helps because I personally really learn better with hands-on learning, and I feel like a lot of people do better or learn better by just doing doing the work and just repetition. And I think it helped me a lot and helped me gain confidence with life skills like CPR and stop to bleed. And I think the confidence that I gained from GIB helped me get into more health related stuff. That's why I feel more confident when I joined. I am now attend EMT courses at St. Mike's at the moment, and I don't think I would have felt comfortable doing that without the training I did at GIB. So, and all the connections you make with your peers and professionals, and they can just help you out in the future.
My name is Eviana Ryder. I am a senior in high school in Vermont Commons, but I live in Burlington. I would like to talk about my experience at GIB and how I view it. The technical skills you learn there are just fundamental to life. I have had experiences in my past where somebody needed emergent care and did not receive that because nobody was trained in CPR and a life was lost. After GIB, I am confident that if I went back in that situation now, that life would not be lost. If somebody was to drop right now, I could save you because of GIB. Now on to more mushy stuff. I made so many friends. It was great. I go to a tiny school. I don't have a broad community. So I was able to make friends from all around Vermont. GIB draws from every corner. Furthermore, it gives you connections into career pathways, especially health and medicine. I think I just met about half the EMTs at UVM right now. My mentor, Kevin, is part of AHEC. He was here earlier at the GIB table, if anybody met him. He's wonderful. He taught me everything I know. But as we all know, that is especially vital right now, making connections into healthcare. My dad is a doctor at UVM. I have grown up fully aware of every issue, administration issues, patient issues, staffing issues, and GIB is where that junction is. It's gonna create retention in Vermont. Why should anybody go outside Vermont if they have the pathway in their career built in, if they have those connections already? He is taking an EMT course. I have a friend who got his VFR. He's now working as a ski patroller at Sugarbush. He doesn't need to go anywhere else because his career is already laid out for him after GIB. It's just a really wonderful experience, and it's so helpful. Health and medicine was amazing. Not only did we get EMT certifications, did you get prepared for EMT certifications, but you also got to experience sheep brain dissections, sheep heart dissections. She brought up respiratory therapy because that's something that was offered to us. I took a little course in that while I was there. It's just a wide variety that you're introduced to. If that's pathways that you want to experience, that's pathways you get to explore at GIB. And that has really helped me and so many of my friends and peers get into this field. I have a friend who now is gonna go shadow at UVM to see if she wants to become a nurse, because GIB has inspired her to do so. It's really important, especially with our healthcare system as it is right now. Thank you.
Thank you.
Thank you.
Are you graduating this year?
I actually kind of just graduated. Yeah,
Congratulations.
graduated early.
And where are you going to? Do you know where you're gonna go?
Yeah, I'm about to do a semester abroad. And then I will be going to University of Denver.
Go ahead.
So you talked a bit about your interests and your goals, but could you just reframe it, each of you, and just say, like, before this program, what was your interest? And now what is your goal? If you have one, because if you're like, I still don't know, it's okay, you know.
For me, I didn't really have a particular goal in mind. I wanted to experience what it's like to be in this field so I can see like if I want to be part of it. And afterwards, I still don't know what exactly I want to do in that field, but I've taken even more interest into that field. So I think it just really helps me at least focus on what I want from that.
So it was a chance for you to explore an area of interest and confirm that it's a pathway you want to stay on.
Yes.
Okay, and then what about you?
It's quite similar for me, a little bit different. I know I'm interested in international relations. That's what I am studying in college. My major is confirmed already. However, I did health and medicine at GIV because I find it deeply interesting. My dad inspired me to do so. And it has confirmed for me that if I don't like international relations, it is a pathway that I intend to pursue as a paramedic or an EMT.
You said if you don't, I heard the paramedic or EMT. What is the first thing you said? If you don't, didn't.
If international relations ends up not being my jam.
I see. Do you see yourself being an international EMT?
I'm really open to anything. I would love that. I think
Space EMT.
Yeah.
Well, thank you for highlighting what it did for you, because it sounds like a great program to help people explore an interest, and that it could be a viable way to recruit people into certain professions where we need more support. Thank you.
Thank you. Jeremiah, did you wanna?
Yes, of course. So nothing I'm going to say. Yes, nothing I'm going to say is going to be as interesting as these two. But I am Jeremiah Breer. I'm a 2007 graduate of the Asian Cultures Institute and the Governors Institute, and I am currently a board member. And I want to emphasize that my speaking to you today is in that capacity and not in my professional capacity as Chief Financial Officer of the Vermont State Treasury. So a couple things that I would emphasize to you. One is that, GIV is investing in young people, right? And it's helping them explore different opportunities and resources and avenues. And I'm sure that I don't have to sell to you that, Vermont has some demographic challenges, right? And anything that we can do to invest in young people and make their futures here brighter is of benefit, not just to the healthcare space, but to the state as a whole. And GIV, of course, has a very specific, as you have heard, healthcare institute, which is very impactful in that area. In my case in particular, as an alum of the program, so I grew up in Cabot, Vermont, in a double wide trailer with a single mother and a very blue collar background. And we didn't really have a whole lot of resources and not a lot of opportunities came my way. And my world was very small, you might say. And that's not actually a bad thing. I actually love that about my upbringing. And that's a very beautiful and wonderful thing, that I was absorbed into this very local rural network. But what GIV did for me was it gave me a whole new perspective. Because when I went to UVM for 1 year, there was a 2-year institute. So the first year we went to UVM and I met all these new people from around the state. And then the second year we actually traveled to China itself and went around for 3 weeks in various different places. And I saw all the landmarks. And that really widened my horizons, right? I had never been really out of the country, except for maybe a little bit into Canada. And I saw different people and heard different languages and ate different foods. And it gave me this different view of the world that I never would have had. And so now, I'm an executive level finance professional in Vermont state government, as it happens. And you might think that the link, from the Asian Cultures Institute to that is like a lot of dots. But the link is that this made me open to new experiences, right? It made me open to new ideas. It made me have the confidence to take risks, and it helped me to grow socially. And so that, I think, just without that, I never would have been able to become the person that I am today. And I would not have the mindset of a global citizen, right? And so not only does GIV help us with addressing Vermont's demographic issues, but when we talk about sort of investing in young people and keeping people here, it's not just about keeping people here, right? It's about the quality of those people's lives and the ability of them to contribute and the perspectives that they have. And so GIV really contributes in both of those ways, I think, very powerfully. So that's the first thing. And then the second thing that I will emphasize is that as we are asking you for funding, right? So as I mentioned, I'm the CFO of the Treasury. I have 15 years in financial management. I'm trained as an accountant. I am certified. public accountant, and in addition to, my professional capacity, I've been involved with many different nonprofits and many different, budgets and organizational structures. And what I can tell you about GIV is that it is this especially well-run organization. They will steward every dollar that you give them to the utmost. They will not waste any money. Anything that you give them will be used in the most efficient way to manage their impact and to further their mission. And so just want to plug you that, as state dollars are, scarce and you're allocating among resources, I would just, both as someone personally impacted by this and so involved in it, and as a financial professional, I would say that this is one of the best and most impactful, sources of dollars that you could allocate anywhere. So that's what I have to share for you today.
Thank you. Go ahead, Leslie.
As a proud parent of a GIV grad in the early 2000s, I guess, everything they say is true. That it opened his eyes. He went into the Arts Institute. It opened his eyes beyond his own and our expectation. So yes, I really want to say thank you for that work and that it's all true.
While we have young people here, this strays a little bit from the topic,
Is this
but
going to be AI?
no.
Okay.
I did already hear from them that they studied AI, so, and if you want to be a witness, if we talk about that issue, that would be great, but Jeremiah, you just said that you mentioned the demographic issue and about young people staying in Vermont, and we rarely get young people as witnesses. What would make young people stay in Vermont? It strays a little bit from the topic, but this is like using your GIV opportunity, like to influence us.
It's the cost of living.
Yeah.
Young people are moving out because they have no place to stay. Like, it's very much a housing issue. It's very much a cost of living. The price of groceries is insane right now. If I was not living with my parents, I would be able to afford like cheap ramen every day. That's not quality living. That's not something that people want, which is why they're moving away. There's not enough job opportunities for what they want to go into, which is why GIV is so important. We need to encourage them to stay here and provide them with those job opportunities, provide them with the career interest that they want, and give it to them young so that they understand that is an opportunity they are provided here in Vermont.
Just to make, I like to summarize to make sure I heard. I'm not saying exactly what you said, but housing was an area, affordability, especially I was hearing food, and work opportunities that align with their interests and passions. Those are three main areas we could focus on that would retain young.
That is my belief.
Okay, thank you. You want to weigh in or?
All right.
Always let us know later.
Madam Chair, if I might just highlight, the fact that we're one of the few organizations that is bringing young people into this building, I think is actually a powerful argument for the effectiveness of GIV.
That's why I was like, we should take advantage of this, using the investments maximum by asking the young people everything we can while we have your time. So thank
We
you.
are happy to connect you with other young people if you're looking for witnesses.
Thank you.
Thank you.
Sorry.
Yeah, go ahead.
Do you have any data that shows, for instance, Henry, I was glad to hear that because of GIV, you chose to do the EMT program at night. Do you have any data that talks about the kids who go through the program, specifically this one?
Yes, so thank you for the question. This has been a really challenging thing for GIV overall. We're a small organization. Trying to track everybody is really tricky. Because of AHEC, you asked about AHEC's involvement. They have more capacity to track this, and they have been tracking this. And so it's in the document that I shared with the committee, there's some more data. I'll
great.
give you a
Okay,
couple
thank you.
points, which is that, post-secondary enrollment in Vermont is very low compared to the graduation rate from high school. But for GIV students, it's quite high. And many of those folks are going to a Vermont college. And of the folks going to college, many of them are choosing health-related degrees.
Thank you.
Appreciate that. Yeah. Thanks for the question.
Any other questions? Well, thanks so much for coming in.
Thank you for your time.
Good luck.
Thank you, Chair.
Yeah, thank you so much.
If you think of anything else we can do to keep young people in Vermont, be in touch, guys.
Affordable housing. Burlington.
All over. It's okay, you're right. Thank you.
Stay alive.
It's great. My son went to.